I think a lot of people are probably familiar with vitamin E and probably even take it orally for its antioxidant properties. Skin is obviously our window to the world. And so there's presumably a lot of oxidative stress, particularly from UV radicals. So my understanding is vitamin E, I think for scar improvement, a lot of times it's recommended, but particularly, supports the skin barrier by sort of neutralizing these free radicals. And because of its moisturizing and anti-inflammatory properties, I think it helps with scar remodeling because there's a lot of inflammation when scars forming after like an acne bump or after some kind of trauma.
Welcome to the Peak Health Podcast, where we dive into everyday choices that shape our health in profound ways. Today, we're thrilled to welcome back Dr. Meenal Kheterpal. If you haven't listened to her first episode yet, be sure to check it out. We covered invaluable insights on how lifestyle changes affect skin health, along with practical tips to protect and care for your skin. Dr. Kheterpal completed her training at the University of Michigan and now practices at the Duke Medical Center, specializing in dermato-oncology. She has an interest in obesity-related skin disorders as well, and how to improve them through weight management. Her passion lies in exploring the connection between lifestyle choices and skin health, revealing how simple science-backed adjustments can help protect and enhance your skin. Before we dive in, I want to disclose that both Meenal and I have a financial interest in Rewinding RX, a supplement company that will be offering some of the products that we are discussing today. Welcome, Meenal.
Thank you, Dr. Gupta, for having me for the second time.
Yes, it's great to have you back on the podcast. Your first podcast was amazing, and I got so many people called me afterwards and told me how they got so much out of it. So I'm really excited to have you back, and talking about some other topics that people I'm sure will enjoy, including advancements in skincare that people may not know about. So before we get into that, sorry, go ahead.
Thank you so much for that feedback. And I'm really excited to dive deeper. A lot has happened even since that podcast. Even I myself and you as well, I have taken a much deeper dive into just, the aging space, or the anti-aging rather. So I'm excited to be back.
Awesome. And that brings us into our first question is, what happens to our skin as we age? Why do we get these bags, these sags, these color changes, volume loss, etc.?
So it's a great question, and it's one of those questions that leads into sort of a framework of thinking about skin aging overall. A lot of times we don't even realize that we are aging until, one day we wake up and we're like, gosh, how did I get to this point? How did my skin look so different? And often that, may be triggered by a picture of yourself that you saw before, or someone points out something to you, right? So it's a very slow process. And the way sort of I think about aging, and again, I would just say there are many frameworks of thinking, dermatologists think about a different way from a clinical research standpoint. But I sort of think about it, in three different ways, or at least the why of how we age. I think about it as like intrinsic aging. And this is sort of, packed as a parcel into our genetic makeup. So we do have our cells that have a lifespan. So we have cells in the epidermis, which is the first layer of the skin. We have the cells in the dermis, and they just die. Like one example I have is of collagen. So collagen, a lot of people have talked about it. There's a lot of collagen supplements out there. It's sort of the bread and butter, matrix that's underneath our top layer of the skin. So it's in the dermis, and it forms the sort of the scaffolding of our skin. I always say that, you've got the top layer, which is the paint of your skin, but then the drywall of your skin is the collagen. That's really the structure on which the top layer is lying. And collagen has a half-life of about 17 to 18 years. So you're going to start to notice some significant changes in your 30s and your 40s, and it goes on. So that's sort of an intrinsic example of aging. Our epidermis, or our top layer, also thins out, unfortunately, and it makes it more fragile. One of the most common complaints that I get from people is that they literally touch their skin and they may be somebody in their 70s and it bruises because they're just, both layers are thinning out, and the access to the underlying blood vessels becomes a lot more accessible. So we call it purpura, or, these excessive bruising. And then the skin cells just turn over slower. So those are examples of intrinsic aging. The second pillar is sort of like the cellular mechanisms, that what's happening, that's like more of a structural level, our first vertical. The second level we think about is like what's actually happening inside the cell that's causing these structures to sort of die off, so, as we speak. And this comes back to free radicals and, sort of metabolic stressors on the cells that damages the DNA, the protein, and the lipids in the skin cells. We talk a lot about lipids in the skin cells because a lot of the soaps, detergents strip away those lipids, and those are important. So we'll come back to that. just intrinsic inflammation, our immune system ages and starts to react to things that maybe it shouldn't be. Mitochondrial function is really important. There's a lot of buzz around the anti-aging space around optimizing mitochondria that are the powerhouses of our cells. And I'm sure we'll get into that at some point in a deeper level. But as the cells age, the energy production dies. And so is the ability of the skin to regenerate itself. And then one thing I want to point out is the glycosylation of the cells, or the sugar impact of sugar. So sugar molecules bind to skin cells just like they bind to your blood vessels. So, the patients who are diabetics are very familiar, with the damaging effects of diabetes or high blood sugar. Skin's no different. You see the glycosylation and you see the, damage to the skin. So those are some of the cellular mechanisms. And finally, of course, environmental, which we sort of explored in our other podcast, but, UV radiation being number 1, 2, and 3 out of all damaging agents, to the skin. But pollution, smoking is a big one. And of course, diet and nutrition, stress, sleep, all of those things. So happy to dive into any of those further.
Yeah, well, thank you. That was quite a detailed encapsulation of what happens on a biologic level, molecular level, and then what the environmental impacts are. A lot of the things you mentioned are genetic. What can we do from a lifestyle perspective to prevent some of this from happening?
Absolutely. I mean, you really can't fight your genetics to a certain degree. Like one thing we were just talking about before getting on the podcast is, aging can look very different, different people. And a lot of it could just depend on your skin color, for example. Of course, much more than that, but that's one easy example to understand. Someone who is very light-skinned, I would say like a blonde hair, blue-eyed person, or a red hair, green-eyed person, Fitzpatrick type 1 or 2, as we would say, would age differently. Like their aging may be more noticeable in terms of fine and deep lines or wrinkles. They may notice a lot more visible blood vessels or dilated blood vessels. Sometimes people call it sort of, rosacea, but it's confused because photoaging has a component as well, where it just presents with rosacea-like skin as people age. Versus someone, who's a Fitzpatrick type 4 or 5, like Italian, Mexican, Indian descent, might notice a lot more discoloration, so uneven pigmentation, might notice a lot of dark spots or age spots show up, dark circles, and may not struggle as much with like fine lines and wrinkles. So that's one example of how you can't fight your genetics and aging can be different. But in terms of environmental factors, obviously sleep is something you can control. I don't know. Have you ever woken up in the morning where you had a terrible night of sleep and just noticed your dark circles just got darker?
Yeah, 100%.
So what's happening there is you're just getting a lot of venous congestion because your eyes are tired and they need more blood flow to repair or to survive. And, in that way is at least the way I understand it. So having a good night of sleep, keeping the stress levels, or at least dealing with stress, acknowledging it and dealing with it, coping mechanisms, really important. Stress leads to really high cortisol levels, and cortisol is just like not a healthy, chemical for the skin. And then just, keeping up with nutrition, avoiding smoking, and as we always talk about, avoiding ultraviolet radiation.
Yeah, right. It's interesting. People think of the skin not necessarily as an organ system, but it, in fact, obviously is one of your biggest organ systems. And as you age, you see these changes in your skin. And that's also, some of those changes are also happening internally. So, when you talk about nutrition, exercise, stress, mental health, sleep, all those things, I mean, not only do you feel better internally, your body functions better, but it actually helps your skin as well. So, the pillars of functional medicine that I talk about in this podcast all the time, those things are so important for so many reasons. And one of those reasons is to help you look and feel youthful. So, and we spoke a lot about this in the last podcast, so I won't go into too much detail about these things, but I find it really interesting on how different people of different ethnic descents and different skin colors sort of age differently. So does that mean that so different people would benefit from different types of supplements to help prevent some of those things from happening, depending on their skin color and ethnicity?
Yeah, so that's a really good question. And I think this is a good time to introduce how us, like as a group of dermatologists, how we think about aging. You can imagine if we are doing a clinical trial for a particular supplement or a cream, you would have to have some fairly defined, endpoints. So some of the things that we see is, as I mentioned, fine lines and deep lines. So, fine wrinkles or deep wrinkles for sort of lay language purposes. We talk about volume loss. It's a big, volume loss is we're seeing a lot of that now in the era of treating obesity with GLP-1s. When you lose a sudden amount of weight, quite a bit of weight, you see a lot of volume loss in people's faces. You also see the sort of broken blood vessels or like rosacea-like aging. And that's, that can be a pretty prominent sign for someone, and people can be really conscious about. And then finally, we also look at sort of just the overall like hydration, some subtle clues like pore sizes. So those are some of the endpoints, that we're looking at. Now, so as far as treating them, people age differently in, with their skin type, just one example. But for example, someone may have more prominent pore sizes, and that's really bothersome to them. To date, there's not that much that we know that treats pore sizes, except, tretinoin, for example, and its oral pill cousin, isotretinoin. So interestingly, I've kind of seen more people look towards Accutane or isotretinoin as its generic form into photoaging nowadays, because one of the few things that can help reduce pore sizes as we age. So that's one example of how people age differently and what we can do differently. As far as some basic things, I think those are common. For example, women, when they hit menopause, significant dry skin dryness is a common complaint across. So improving hydration, improving just skin elasticity would be a common thing that we should probably aim to target, for most women, at that age and stage of life. So those are just a couple examples to highlight how some basic things could apply across the board, but then we can also do specific treatments.
Interesting. Okay. So let's talk about some of those treatments now. There's so many different supplements, creams, medications that are now in this anti-aging space, and some of them may potentially have benefits, some of them have proven benefits, some of them really don't. So let's go down, a list of some of the top ones that you think about that really help in this anti-aging space, and how and when you would use those supplements. The first one I have is tretinoin.
Great choice. So if you were looking for the list of anti-aging treatments or medications out there, and if that came up as number one, it should have been number one. And the reason for that is that, there are very few things that truly have, clinical trial level data, randomized control, top level clinical trial data that clear cut show that it helps with, the aging process or reverses or halts the aging process. And tretinoin's up there. Tretinoin is a cousin of vitamin A. I know a lot of people take vitamin A for hair health and skin health. I'm not quite sure if we have a lot of data for vitamin A directly affecting skin health, but we definitely have data for tretinoin. And like I said, also it's sort of, oral cousin isotretinoin. If you've ever seen someone who's taken Accutane and sort of in their final months of treatment for acne, they have this, what we call Accutane glow. And it definitely helps even out skin tone, reduces scarring, improves dyspigmentation, discoloration, reduces redness from acne and things like that. So tretinoin, it comes in different levels. I think most people hopefully are familiar with it already. The biggest issue with tretinoin is tolerability, because one of the key things that it does is it stimulates cell turnover. So when you start using tretinoin, hopefully using the right strength, hopefully you've consulted with a dermatologist and they kind of prescribe the correct dosing for you. But you're gonna see some sloughing of the skin in the beginning, and people notice that dryness, hate that dryness, and stop using it. So we have to get over that hump. If I could, convince anyone who's listening to this podcast that you just kind of have to get over that initial hump, and figure out a balance between not being too dry and getting retinoid dermatitis versus not using retinoid at all. Like that's the balance you have to figure out. Unfortunately, everyone's different, so it's hard for us to predict. So we have to start somewhere. So we start usually at a low dose. And I always tell people like, okay, you want to start every 3 days, then you go up to, or actually nights, so you have to use it at night, go every other night, and then go up to every night. When you kind of get that sloughing, try to use like a gentle washcloth and try to get rid of that sloughed dead layer. What's really happening is it's getting rid of the dead layer of the skin. So your skin cells can shine brightly underneath there. So it's almost like getting a homegrown facial when you're using tretinoin, is the way I sort of think about it.
And it also promotes collagen production as well, correct?
Yes. So with tretinoin, the nice thing is it acts both on the epidermis and the dermis. It also seems to reduce hyperpigmentation. So it probably has some effect on melanin production slash melanos transfer. So some level of melanin regulation, because it does reduce blemishing and scarring, particularly from acne. So we use it for that purpose as well. But it has been shown if you have a high enough tretinoin dose that's absorbing into the dermis, that it does help with, like we were talking about, that second layer, the scaffold, the structure of that, and protecting the collagen and just the extracellular matrix. The key, I think, with tolerability on tretinoin is to mix it with something that allows to keep the hydration in the skin intact, because tretinoin also reduces sebum or oil production. And unfortunately, as you age, let's say if you're, like me, someone in your 40s and noticing very dry skin, the key of using using tretinoin is to combine it with something that'll, hydrate the skin.
Got it. Okay. And we'll talk about some of those options in just a little bit, because I think you're one of those. You mentioned the last podcast, Andy, was hyaluronic acid was a good hydration tool to use as well.
Yeah, absolutely. I mean, if you're still, people still get acne, so you have to be careful about not using, comedogenic oils for hydration, or using facial moisturizers that are, non-comedogenic. But yes, hyaluronic acid is it deeply hydrates the skin, and enhances like sort of the elasticity, because now you don't have this dry, stiff kind of scaffold of a skin. The problem with hyaluronic acid is penetration. So hyaluronic acid, as you may be familiar, we even have like fillers. The injectable fillers are a lot of the popular ones that are sort of the gateway to fillers are hyaluronic acid based. It's a really nice compound, conserved across species, so extremely safe, extremely safe. The problem is when you're putting it on top of your skin, if it's a large molecule, it's not going to penetrate through the dead skin layer. So using a hydrolyzed version is really, really important. And, those are the types of things that we've sort of kept in mind while formulating for, as you mentioned, Rewinding RX, formulation, so that it's actually getting to the dermis where it can do its job appropriately.
And hyaluronic acid can be expensive. Is there a less expensive option that people could use for hydration that you recommend, or just the general moisturizer?
Yeah, so I'm seeing hydrolyzed hyaluronic acid as not a primary ingredient in most moisturizers, just sort of an add-on. And that also, is kind of a little bit all over the place. Like the percentage of hyaluronic acid could vary between different products. I think somewhere between 0.5 to 2% is probably pretty reasonable. But also, I think being the hydrolyzed version is probably more important than anything else for the hydration purposes. A lot of times it'll get combined with other moisturizing, like for example, oils or non-comedogenic, hopefully oils, which would help hydrate the skin. So I would have to get back to you from a price point standpoint. I've actually never paid attention to that. A pure cost of a pure hyaluronic acid. I know that the fillers, the injectable fillers, are expensive.
Okay.
And I don't know if there's a cheaper version, sadly, because they have
Well, I guess even for just general moisturizing, is there a cream that you recommend that people can get over the counter?
Oh, yes, absolutely. I mean, and I will just come out and say, I don't have any financial interest with any of these companies, but I've always kind of been a big fan of ceramides since they came out. I think we might have even touched that on the last podcast, but CeraVe was one of the first companies that came out. I think a lot of people like that. Ceramide is a lipid. It's a type of a fat that basically joins our skin cells together, and that decreases as we age. So CeraVe is one. They make obviously day creams and night creams. Eucerin is another brand. They're also using a lot of ceramides in their products. I literally cured eczema in my son by using Eucerin Advanced Repair Cream. So I'm a personal fan of them and have recommended to a lot of people who also love it. Great product for winter itching, that sort of, itching all over that sometimes you get from the dryness in the winter. That product is amazing. And most recently, I've started using La Roche-Posay, the Triple Barrier Cream, and I absolutely love it. And that one, I believe, does have ceramides also. I was afraid of it because it does have some oils in its formulation, but so far so good. No acne, comedones, or issues with it. So I've actually also started recommending to a lot of my Accutane patients to use that, because I think it really does stay on the skin for 24 hours.
Okay, great. And we're going to spend a little bit more time with tretinoin and hydration because it's so important, and because there's so much data backing up those things. But the tretinoin, would you recommend to everyone across the board? or are there contraindications?
If we could, we would put it in the water.
Oh yeah.
It's like our version of statins.
Yeah.
Yes, I think we would recommend it to everyone. The issue becomes there are some people, and actually that population is growing, as eczema affects like 1 in 3 kids in the United States, and a lot of people have sensitive skin. We struggle with using the traditional tretinoin for some of those folks that have really sensitive skin. Couple of different options for them. There are more gentler retinoids. Differin is one of them. Adapalene is its generic name. Used to be prescription for acne. It has now gone over the counter. It has actually 2 dosages. The lower dosage, the 0.1%, is now over the counter. You can get it at Target, Walmart, and it's under $20. So I think that if you're someone who may have sensitive skin and doesn't want to pay the cost of a prescription drug, I think a great place to start is Differin. The other advantage of Differin is that it is very stable. So you can use it during the day. You can use it in sunlight versus the tretinoin you always have to use at night. And sometimes, you're tired and you're not consistent with it. But during the daytime, Differin is really helpful. So that's one way. The other brand that I think is also advertised to be gentler, and I do think people like it, is called Etrino. It's a slightly different retinoid, and it's pretty easy to actually get that prescribed online because it's, again, it's just another tretinoin version, but like a slightly different retinoid class. But that's also supposed to be gentler on the skin for the sensitive skin folks. One category of patients that always comes up is pregnant and breastfeeding moms. And I think I might even said this before. I used it all throughout my pregnancy because I don't think there's enough systemic absorption of tretinoin, but some people may not feel comfortable. So we may not want to give tretinoin to them, but I have my 12-year-old using tretinoin already. So we definitely start as early as you can.
What if someone has dry skin, extremely dry skin to begin with?
Yeah, so a lot of dermatologists will, I think, talk about the sandwich technique. So if you have super dry skin, you can obviously start on a low dose tretinoin, or you can start with Differin. That's one strategy. But even if that's very, very tough, you could do like a layer of a thin moisturizer, like maybe a Cetaphil, then use your Retin-A, and then wait a few minutes and then apply another moisturizer when you're using it. So it's like the sandwich of tretinoin. Essentially what's happening though is that you're just using a very low dose of tretinoin at that point, because the lowest dose is 0.025 on the
Right.
market, and you're basically effectively lowering it. So one thing that we did with the Rewinding RX formulations is that we created an extremely low dose tretinoin, which is like around 0.01%, which would ideally be safe even to use every other day or so around your eyelids, because as you can see, a lot of fine lines start to develop around the eyelids, and we definitely need some of this effect there and to protect that thin skin. So you could do sandwich technique, or you can look for extremely low percentage formulations of tretinoin.
Is it better that people start using that? And I think you alluded to this already, but is it better that people start using that early on in life to prevent, aging over time? Or if they start in their like, mid 40s, mid 50s, will it have like a similar effect?
I mean, I think there's no wrong age to start using it, but a lot of people use it when they're younger for acne. So I
Uh-huh.
think it can have it can have a really nice preventative effect on acne, because it prevents like comedones from forming and helps treat some of the blemishes and, the scarring from acne. I think that when people do use it starting early, it does protect the collagen and prevents the aging from a dermal standpoint. The downside to that is, a lot of times people are very active or playing sports, and it can make you a bit sensitive to the sun. So it also comes with that requirement of wearing, a very good sunscreen with it when you're younger. But that's a good thing. We love that too. So
Yeah. Best of both worlds.
yes.
What happens when you get exposed to sun and you are using tretinoin?
You can get a sunburn much easier because so tretinoin increases that epidermal turnover. So it increases the turnover of the skin. This is how it kind of makes the skin appear brighter. So
Uh-huh.
the dead layer, the stratum corneum that's deflecting or scattering some of the UV radiation, is now much thinner. The
I
other
see.
thing to think about, similar to that, is, if there are younger folks who are getting any kind of hair removal procedure, like with waxing or threading, you have to mention, you may have to stop your tretinoin for a week or so before you're getting your like eyebrows waxed or something, because it'll pull the skin is thinner, so it can pull even the thin dead layer behind, off, and then it can be really very sensitive for like a week or two.
Oh, I see. Okay. All right. Excellent. So let's go on to the next one, niacinamide.
Great question. So niacinamide is sort of like a jack of all trades. We're still trying to figure out that the mastery of niacinamide, as you had alluded to earlier, it's sort of related to the NAD or NMN, that whole pathway that is, that's becoming really popular in the anti-aging space. But niacinamide in dermatology is like an age-old treatment. We use it a lot to generally reduce inflammation in the skin. So for example, historically, we've used it for a lot of blistering conditions, rare conditions like, pemphigus or pemphigoid, which maybe most listeners don't know about, but this is when your skin blisters due to an autoimmune condition. So very serious. We have to use fairly high doses, like 500 milligram twice a day. It reduces, sort of uneven pigmentation. It's a form of vitamin B3. It helps regulate sort of oil production, kind of helps to strengthen the skin barrier, and it's an antioxidant. So with those roles, we find it lots of uses for it. Like I said, it's a jack of all trades. So it helps with the skin barrier, helps with like folks with sensitive skin, like rosacea, for example, that we were talking about. For them, niacinamide can be really, really helpful. So we use that a lot in rosacea formulations. So those are a few benefits to name of.
And is this something that you would recommend for everyone, or are there certain contraindications to this as
So
well?
really good question. Personally, I think it is very valuable and helpful to the skin. And I do think that with for example, if you're someone who does want to have sensitive skin and tretinoin is like not an option, or you can't use that. I mean, niacinamide is a great anti-aging agent. However, niacinamide topically, well, I guess orally, was studied to reduce precancerous lesions in the skin. It's a big study. It's published in the New England Journal of Medicine. It's a big Australian study. And they were looking at, I wouldn't say this was an aging study, because they were really looking at precancerous lesions reverting back to non-cancerous lesions. But if you kind of go back to the basic idea that DNA damage is what's leading to aging, well, that same sort of DNA damage is leading to precancerous lesions, which maybe a step forward, in the ladder of like normal skin, aged skin, precancerous skin, cancerous skin, sort of that ladder. So if you
Right.
kind of put it along the same spectrum, niacinamide reduced precancerous lesions by like 25%, range over the duration of the study, which was, it wasn't a multi-year study. So over a pretty short duration and very, very rigorously tested. So based on that study, I think, yes, I think we should give it to everybody. But I think there is some controversy, about antioxidants in the skin, and could they be harmful at some point? And I don't think we'll ever I don't think we have enough data to settle that debate yet.
Right. Yeah. And we were discussing this prior to the podcast, but there are other forms of niacinamide, or, as it progresses through your metabolic pathways, NAD is produced. And many people hear about NAD in the anti-aging space, oral or subcutaneous NAD or NMN or NR. Those are sort of earlier formations of the NAD molecule. So it sort of works along those same pathways as well, as my understanding. Is that correct?
In the skin, I would say well, to be honest, I don't know if we fully understand all the benefits of NAD even systemically, or at least maybe I should say I don't.
Right.
But I know in the skin, it has some direct, effect on inflammation or inflammatory cells, and then some direct, effects on oil glands and melanocytes, which make pigmentation. And so, maybe it's working the exact same way, just making skin cells do a better job at what they should be doing already. But I think we definitely need more robust studies that are, more basic science oriented to answer those questions.
Absolutely. Okay. All right. So that was another one with a thumbs up. Let's go to the third estriol.
So lots of buzz. Great question. I'm actually kind of impressed that you even have that on the list. So lots of buzz about
I got this list from
estriol.
you, by the way, so I can't take full credit from all of these.
Some of that stuff that I've been researching, yes. So estriol and estradiol are definitely getting, a little bit more buzz. And I'm going to hypothesize as to why that is. There are some recent papers that have shown that there are estrogen receptors on fibroblasts. Fibroblasts are basically the cells that are making and laying down this collagen. They're important in wound healing. And so essentially, if you say that, again, coming back to that scaffold or that drywall of our skin, if you can protect it for longer, you're definitely going to you're definitely going to affect the aging process. So if there are theoretically estrogen receptors on the fibroblasts, and theoretically estrogen could stimulate them and promote elasticity in the skin, and sort of more of that supple skin phenotype, then estrogen should be replaced, especially as we are getting lower in estrogen. And then the other component of that is, for example, men don't have as much estrogen as women, and it's a known fact that women have more elastic skin, than men. That's a fact, and we think estrogen has a big role to play. So I think that's kind of the phenotype to genotype sort of story. There are two different types of estrogens that we know topically exist. It's estradiol and estriol. Estradiol is, maybe people are familiar with it because it's actually used a lot, sort of for, vaginal atrophy, during around menopause and sort of like that kind of treatment. My understanding is also much stronger estrogen, and sometimes can have some side effects too, like sometimes vaginal spotting and things like that. So my personal preference, I think they both seem to have a couple of head-to-head clinical trials that at least I could find in humans. And they both have been shown to improve like skin elasticity, hydration, and sort of the overall brightness and appeal of the skin. However, I do believe that estriol, being a weaker estrogen, seems a bit safer, especially for, women in their 40s, 50s with the risk of breast cancer, ovarian cancer, and that kind of stuff, especially if you have a family history and things like that.
Sure. What about men? Would men benefit from this as well?
I mean, theoretically, they would. The question is, how much of this are you absorbing systemically? Because as you know, if men are exposed to medications that are more feminizing, like for example, spironolactone is one, you can, have some effects like gynecomastia and things like that. Based on at least the two studies that I'm talking about, there wasn't any systemic absorption, as long as, we observe the percentages and the similar type of absorption in the vehicles that those studies use. So I think the devil remains in the details. I think, if would I be afraid to have a man try it? I don't think so. I think you'd have to try it and just make sure you're paying close attention to the side effects. My understanding also is that if you do notice some kind of side effect, you can just stop it and it's reversible, So I would say if I was someone in my 40s and I was male, I would definitely try it, because I think there is some compelling data as to the effects of estrogen. You definitely cannot take it systemically. So topical will be a really good option, especially in the estriol formulation.
Interesting. So really the best use cases here are menopausal related changes in aging, dryness, thinning, and that type of thing. Those are the people that would be best suited for this type of stuff.
Absolutely.
Yeah.
Absolutely. I think those women would significantly benefit from this, and fairly quickly. These studies are done over 3-month periods. So it's not like tretinoin, sometimes you're looking, changes over 6 months to a year. Estriol, for example, is very easy to tolerate, no adverse events, significantly improved hydration, brightness, to a certain degree, improvement of the skin, atrophy appearing skin, and just, yeah, overall brightness of the skin.
Right. And I do understand in the perimenopausal women, hormone replacement therapy is very much encouraged nowadays. The Women's Health Initiative study scared a lot of practitioners in the past with adverse events in taking hormone replacement. But what we've discovered recently was there were a lot of faults in that study. So a lot of practitioners that are taking care of women in the perimenopausal state recommend estrogen and progesterone replacement therapy, and it is quite safe. Of course, if you have breast cancer or history of breast cancer, that's, as you mentioned, that's something to be wary of. But otherwise, that is very safe. So I imagine a cream, is equally safe and probably could be used in most people without any issues. Most women, at least.
Yeah, I would completely agree. And then to even be more conservative, I would side with the estriol formulations. They might be a tad more expensive, actually, from my understanding. But I think for that extra level of safety, to make sure that, especially if you're worried about like history of breast cancer in the family, like using an estriol formulation, I would say is, fairly safe, of course, as long as you're getting regular mammograms and things. And along those lines, this is a little bit off of a tangent, but I would like to put a plug in. I get a lot of sort of people, especially when we're treating, teenagers with acne. Like in Europe, my understanding was one of the first treatments for acne is actually a combination estrogen, progesterone, oral contraceptive pill. And this may be controversial for, religious and other reasons, but that I'm not arguing. But, combination birth control pills have been shown to reduce the risk of breast cancer and hormone-mediated cancers by, continuous use for 5 years reduces your risk of hormone-related cancers. But somehow, same thing, the sort of the risk of deep venous thrombosis or like a clot in your legs and pulmonary embolism, stroke, things like that. Like a few cases of that has really, I think, had a lot of people afraid of taking, oral contraceptive pills. But I think the oral contraceptive pills, also have a lot of benefits, especially in the world of obviously prevention of cancer, but also like in the world of acne. So I would just say again, some of these estrogens and progesterones had a lot of data that corrupted their reputation early on, but we understand it better now.
Yeah, absolutely. Okay, let's move on to another one that which is very interesting, sirolimus.
So that's something that is an emerging molecule. I know you've, followed Peter Attia, he's kind of created a lot of buzz around it. My understanding of sirolimus pre sort of some of the more modern understanding of the mTOR pathway was, in the transplant population, as you mentioned, that, do a lot of skin cancer research, and we love sirolimus in that space, and it protects the graft or the transplanted organ and protects against skin cancer. Again, so if I could put forward that paradigm of, normal skin, aged skin, precancerous skin, and cancerous skin, and if this particular molecule, sirolimus, is preventing, sort of those bad actor skin cancers from forming, or preventing their formation, then, you could almost extrapolate that it has some benefit towards anti-aging. And I think more recent data showing that at least on a cellular pathway level, it is helpful, for in terms of, protecting the cells from aging. Topical sirolimus has a growing body of data. I don't know if we have a randomized controlled trial currently for sirolimus in the anti-aging space, but it is approved for a condition called tuberous sclerosis. In this condition, these patients make a lot of these sort of bumps on the face, which are called angiofibromas. In simple words, this is just a combination of, too many cells in combination with some extra blood vessel proliferation. And as earlier in the podcast, we talked about one of the signs of aging is this blood vessel proliferation, dilation, and prominence in the skin. So the idea is, could this be used for some of those redundant, bumps and things that we develop, sebaceous hyperplasia, seborrheic keratoses, obviously some people have these angiofibromas, for treatment of those, or at least prevention of those. So I think it's a very interesting molecule. I think it's very forward thinking. The oral sirolimus does seem to have some systemic side effects, like dropping of your very important white blood cell count, so particularly neutrophils. So you could have different side effects from that, infections and things. But topical is a great route, I think, to try some of the, to exploit some of the anti-aging properties of sirolimus, in my opinion.
So have you used this cream or suggested this type of cream for patients of yours?
I have. So in the use cases where I've used it, and I think there's been a lot of success, is in patients who have a lot of these age spots called seborrheic keratoses. So a lot of the times we don't treat them. They're benign, first of all, not covered by insurance, but if we do treat them, they grow right back. And I've had a few patients who, literally begged me to treat these. And, with the amount that they have, I feel terrible for them. So we do treat them either through destruction, cryotherapy, whatever, laser, but they grow right back. And so in that setting, what I've done is used sirolimus for patients after we've treated some of these larger lesions to prevent regrowth. And it seems to be very effective for that patient population. I would like to make sure that was not under a clinical trial. This is sort of anecdotal, experiential data, but it comes back to the same preventative effects of sirolimus. Could you start using it on your face if you have a family history of your, mom or your aunts or your dad making a lot of these seborrheic keratoses? Patients come in and they tell me, like, oh my gosh, I'm starting to look like my mom. She has all these spots, et cetera, So if you're going to be in that category, could you, fairly safely use sirolimus and prevent some of those, in addition to, of course, more known preventers like, sunscreen and tretinoin to prevent those seborrheic keratoses and tychines.
Yeah, interesting. So, in my understanding of the literature, sirolimus is one of the few molecules that have been proven to prolong lifespan. There are very few actions and molecules that are able to do so. In fact, I think this is one of the only ones, if not the only one. I do know there is also animal data on caloric restriction, but obviously that's going to be very difficult to do in humans because in the animal studies, it was a significant amount of caloric restriction that caused this anti-aging phenomenon or prolonged lifespan phenomenon. So that's why Peter Attia uses sirolimus. I believe he uses like IV or subcutaneous form of it. And he mentioned that he would get these aphthous ulcers, probably related to the immune response that you get from, or decreased immunity that you get from injecting it. But he does it on like a weekly basis, and because of he's so data driven. So it's interesting to hear that he is using this molecule himself. So anyway, that all being said, would you recommend this cream for people that are interested in, anti-aging and skin health?
I think it's a very forward-looking compound. We know that it, reduces the expression of like P16 which is a marker in the skin for cellular aging. So I think based on some of the preliminary data and like some of, the excellent sort of safety profile of a topical, I think it's a very forward-facing molecule. I think we'll learn more about it, of course, with some robust, clinical trials. The safety data, by the way, has been established more from the tuberous sclerosis study. So it has human data for treating, like I said, angiofibromas. So for an anti-aging off-label use, I personally would love to use it and, sort of see how that affects, because I'm starting to get some of these sunspots and lentigines despite, very aggressive sunscreen use and tretinoin and so on and so forth. So I'd be really interested in knowing if this could be another, weapon in sort of our fight against aging and sort of delaying that sort of frontier.
Interesting. Okay. All right. So that's very interesting. So let's move on to the next one, vitamin E.
Well, I think a lot of people are probably familiar with vitamin E and probably even take it orally for its antioxidant properties. Skin is obviously our window to the world. And so there's presumably a lot of oxidative stress, particularly from UV radicals. So my understanding is vitamin E, I think for scar improvement, a lot of times it's recommended, but particularly, supports the skin barrier by sort of neutralizing these free radicals. And because of its moisturizing and anti-inflammatory properties, I think it helps with scar remodeling because there's a lot of inflammation when scars forming after like an acne bump or after some kind of trauma. So that's kind of, where in the situations where I would potentially use it, for aging skin, obviously oxidative stress. If you have additional lifestyle factors like, extremely stressful life or you're, a smoker or something, vitamin E could be really, really helpful.
Okay. Interesting. Would you use it in and of itself, or would you use it in combination with some of these other molecules?
Great question. I think in the list of anti-aging, like if you're purely talking anti-aging, I think the benefits of vitamin E are more of a supportive role. Like I said, I think I would use it more for like a scar revision, or scar remodeling phase, maybe post-acne, that kind of stuff. But for anti-aging, I think it's more of a supportive role. For anti-aging, I think that an antioxidant in a similar category that would have maybe more benefits, it would be vitamin C. And, vitamin C, the story behind vitamin C really is that, if it's a vitamin C that actually penetrates the skin to where it needs to go, it's a very effective, molecule.
Right.
And vitamin C, the holy grail is sort of like it's a brightening agent, and it's because it sort of helps with decreasing hyperpigmentation by its ability of, inhibiting melanin production. So depending on the type of aging, again, you're experiencing, if you're sort of in the FITS 3-4 category and you're getting a lot of uneven discoloration, then vitamin C is like one of your, should be one of your top ingredients from an anti-aging perspective.
Okay. So maybe some kind of formulation with a combination of C, E may make sense in that situation.
Yeah, exactly. E wouldn't hurt. Would it be okay by itself? Probably not without vitamin C.
Okay. Okay. Great. Okay. So let's go on to the next one, 5-fluorouracil.
Yeah, so this could potentially be controversial. 5-fluorouracil is a therapeutic agent. And I'm just going to share more of my sort of anecdotal, evidence. So 5-fluorouracil, again, we use it for precancerous lesions. We treat them all the time. And again, going back to that model of, normal skin, aged skin, and then cancerous skin, if we can reverse the precancers to normal skin with 5-fluorouracil, then can we also reduce aged skin to more normal skin with 5-fluorouracil? And more recently, so it used to be very, very long course, 2 weeks long to 3 weeks long, and everybody's face looked like they were, starring in Deadpool as Deadpool. So we didn't use it a lot, but there is a combination with vitamin D ointment that has made the treatment course much more potent and therefore shorter. So 3 to 4 days of 5-fluorouracil calcipotriene can reduce precancerous lesions, turn them into normal skin in very, very effective manner. So, there's an argument to be made that if you didn't use a very high dose fluorouracil, so for example, you don't need a high dose because you're not dealing with precancerous lesions. So instead of a 5%, a 1% fluorouracil, plus or minus vitamin D, depending on how long somebody wanted to use it, could you use that for anti-aging? And the answer is, I think, absolutely. In fact, there's a formulation called CARAC, C-A-R-A-C, that a lot of people love to use from an anti-aging perspective. I do believe it's a little bit off-label, just like we were talking about some people wanting to use Accutane off-label for anti-aging, but certainly it's essentially like a more concentrated peel. You'd have to be prepared to be, sort of indoors and not have a big event, coming up, but for 3 or 4 days up to a week, you could kind of do that and it'll kind of sort of increase the turnover, reduce some of the presumable cellular aging, aged cells, remove sort of the junk, and help healthy cells surface. And that's sort of my hypothesis. Again, we'd love to have a randomized controlled trial for that, but we know that it definitely removes precancerous cells very, very effectively, and that's been shown for, with randomized control studies.
You could use it sort of like a peel.
Correct. But a peel that's like not just a chemical destructive peel, which is taking away cancer cells as well as normal cells with it. With fluorouracil, because it attacks preferentially the cells that are more rapidly dividing, presumably, closer to sort of the precancerous arena, or the cells that are, that are sort of defective, removing those and resurfacing the healthy cells, helps with photoaging. There's another modality that you could do, something called photodynamic therapy. It's very commonly used in Europe for photoaging purposes, and also in the US, which is a similar idea. But that has to be like, you have to put a chemical activated by light. So there's a few steps, and there's a little bit more complexity to that. But fluorouracil potentially could be used for a similar purpose at a lower dose.
Okay. And can you define photoaging for us?
Photoaging, essentially is aging in response to exposure to light or ultraviolet radiation, to be more specific. Although now there's some data that visible light can also be a bit damaging. So we kind of think that a lot of the aging, accelerated aging, is because of the photo damage. Understanding that collagen itself has a half-life, and so the best way I can explain it is if you compare the skin on your arm to the skin on your buttock, the difference between that's photoaging.
That's a good way to think about it, because I mean, even your legs, you look at them, and your skin may look so youthful, and I see thousands of patients and their legs look a certain way, but then you look at their face and you're like, okay, they don't really match up.
Yes.
That happens very often, and that's exactly as you describe. It's very easy to see when you look at clothing, or parts of your body that are completely covered all the time. Okay, so the last one I have on this list here is CU, which is a copper peptide.
Yeah, that's a great question. Peptides obviously have a lot of buzz around them these days. So I'll try to stay objective. But GHK copper, it has predominantly its effects in the dermis. It actually has a lot of data, and a lot of microscopic, sort of like the electron microscope, like spectroscope level data, showing that it actually helps with the extracellular matrix, or the dermis. So again, coming back to that scaffold. I mean, so far we talked about a lot of things, improving brightness and the epidermal, or the skin, first layer turnover and things like that. Tretinoin is one of the few things that helps with sort of the dermis. We talked a little bit about estrogen kind of penetrating down to the dermis, but GHK copper is another compound that is, it's proposed to improve elasticity, and then the skin sort of density. So improving that scaffold, the underlying scaffold. And you can imagine, once you actually have a firm scaffold, you would have less fine lines, less deep lines, which follow the fine lines. And so GHK copper, and the safety profile is phenomenal. It also seems to regulate melanin production. So it's been proposed to reduce hyperpigmentation, but I do think like a majority of its effect is in the dermis, and that's why it's so exciting. As long as the formulation penetrates through to the dermis, and we can kind of, believe that, so it's the right formulation of, GHK, it's extremely safe and extremely, exciting to have that scaffold improvement.
And is this something that you would compound with some of the other molecules, or just use alone?
Right. So I always like to have, to be efficient, because I mean, how many creams can you put on in a day? We need the sunscreen in the morning. Ideally you want a retinoid, like either tretinoin or a gentler one. If we're saying we want to add GHK and niacinamide and vitamin C and all those things, so it starts to add up. So ideally it would be nice to have creams that have a combination of a lot of these ingredients. So the one that you have to use at night for the most part is tretinoin, and then having a formulation during the daytime, to help with some of these other ingredients, kind of combining them together would be nice. The other way to think about it is, combining things that help with the dermis of the scaffold, along with things with the epidermis. So, combining a vitamin C with the GHK, to kind of have that epidermal effect as well as the dermal effect, missing out, and then maybe using a tretinoin at night.
Okay. All right. So yeah, your explanation actually goes into of combining some of these molecules and when to use it goes into my next question. If you take into consideration all the data that you presented, safety of these molecules, just let's forget cost in this particular question. What would your ideal combination be of these molecules to prevent aging, and how would you take them, like morning, afternoon, evening? And actually, as a part of that question, which ones would you just eliminate?
I think the lowest in the totem pole would probably be vitamin E. You have to start with a tretinoin sunscreen combination. I mean, that's sort of like the holy grail. We just talked about photoaging and how different, covered body parts look to non-covered. So you have to absolutely start with a sunscreen in the morning. But the problem is the sunscreens are barriers. So you almost need a cream underneath your sunscreen in the morning. So I would probably do something that's not sensitive to the sun. So like combination of vitamin C, maybe with like a rapamycin if it's available, during the daytime. And then at nighttime, combine tretinoin, with maybe a hydrating, like a HA formulation. And then you can kind of see where the others fit in, like where your estriol fits in, where your GHK copper fits in the day, if it's easier to do in the morning, at night, because there's no restriction as to when, you can use them. We obviously have a sort of a perfect formulation in mind, and you may have to go to rewindingrx.com to check it out. Doesn't mean it's perfect for everyone. I would never say anything is absolutely perfect for everyone, but we've kind of kept into consideration how these ingredients go together at a chemistry level, not so much like at the biology level, but at a chemistry level, what is compatible with what, and, to have the maximum benefit of all these ingredients into the skin. So we have our sort of, proprietary formulation. Doesn't mean that's the right one, but if you're interested in sort of making it a simple 1 morning, 1 night cream formulation, and we're interested in some of these ingredients, check out rewindingrx.com.
Excellent. And it sounds like if someone is very cost conscious and just wants to do the most basic things, sunscreen in the morning, tretinoin at night would be, with some kind of hydration at night, would be the most basic.
Absolutely. Like that's like a non-skippable. Like, if you're not doing just that, like you can't complain about aging to me ever.
Right. Right. Yeah. Because people oftentimes are like, oh, let me try this new thing or not that new thing or this, like you're talking about some potentially chemotherapeutic molecules and things of that sort. Um, and people want to try those before they even do the basics, and that's a problem. So that sounds great. So just those things, lifestyle, that goes a very long way. These other molecules we're talking about certainly can help, and as you described so articulately, can help in certain ways. But the basics are, obviously the most important.
I couldn't have said it better. I mean, I think aging is a layered approach. Like you said, you have to know the stuff with the most data, at least as of today. Is it the best anti-aging regimen? Maybe not. But until we get more data, you can't skip the basics, especially if there's extremely safe, product profile. So sunscreen, retinoid, I would maybe even throw a vitamin C serum. I really love the La Roche-Posay vitamin C by itself. I think does a great job from a hyperpigmentation brightening standpoint, but not without the lifestyle. I mean, if you're not sleeping at all, none of these can help, so that's
Right.
sort of like is the added layer. A good diet, full of antioxidants in the diet, right? So, and taking maybe like a foundational nutritional supplement to combat that. So that's sort of like your basics. But then as we get older, we do, you start to get impacted by the aging process more. And so this sort of second layer is what we're trying to build to support people who want to prevent that as much as possible. And then of course, if you're sort of at a point where, there is significant volume loss and significant lines and things like that, we have some amazing, tools to help with that. I know there's a lot of people that may not be for it. And again, if you never want to look at Botox, don't have to, but it's a very effective way to get rid of fine lines and wrinkles, and an extremely safe product profile. I don't even do a lot of it, so there's no conflict of interest, but I can say it's one of those modern medicine miracles that can be very effective from an anti-aging standpoint. Fillers, they're different kinds, and that could probably be a whole episode out in itself. And different products have different safety profiles, so devil's in the details with the fillers. But yeah, there's a whole world beyond that. But what we're trying to do is build a very nice foundational stack that, you know, everyone can potentially use and benefit from.
Wonderful. Well, thank you so much, Meenal. This was incredibly interesting and informative, and I'm sure our listeners got a ton out of it. If somebody wants to contact you or learn more about you, how would they do so?
They can definitely email me. It's just meenalkheterpal@gmail.com. I try to get back to people, but of course, you know, depends on what else is on your plate at the same time. But of course, I'd love to hear back any feedback. And if there's any specific questions, would love to take a deeper dive if we didn't cover it, or if there's any contradictory information people are seeing out there, would love to learn about that. So that's probably the best way. And hopefully we can circle back another time for, you know, oral supplements for anti-aging, which is a whole another world in itself.
Absolutely. Well, thank you so much.
Thank you so much for having me.